I spent most of my life as a chef, and I, about 5-6 years ago, decided that I needed to go back to school to understand more about what food did in our bodies. Like I've always been really curious about how food interacts with our bodies and what it does. And so when I went back to school, I was able to figure out exactly how what we put in really interacts and makes a different outcome on how we feel, what develops disease-wise, and how we can protect ourselves health-wise. I've been working with patients, and I lost my dad to cancer about 3 years ago. And so cancer kind of came into my life, and I decided that I wanted to start understanding a little bit more about it and working with people who were living with cancer. And so what I want to say to you all is this. I don't pretend to be an expert on cancer. It's bigger than my scope of practice. What I do understand really, really well is food and the gut. So I specialize in gut health. And I think it was about 2,400 years ago that Hippocrates said, all disease begins in the gut. And he was right. So we're starting to understand now that everything is connected to our digestive system. And so when we think about disease, any disease, we have to kind of start there, because it's kind of like if you think about like a gate to the rest of our body, our digestive system is that sort of gate and the key to making sure that the rest of our body stays healthy. And so when I work with people, I always start with gut health. I know that when we're going through cancer treatment, one of the first things our doctors do is hand us a prescription for Prilosec or whatever to mitigate the stomach problems that come with treatment. And so when we're in recovery and we're starting to look at repairing gut, then we have to look at things that really start to solidify our gut health and close those intestinal barriers. Cancer comes to us, I think, because, well, we have to ask that question, like, why did you come to me? Why did you come to me now, right? So what changes in my life do I need to make cancer unnecessary? So here are some commonalities that I have found along cancer patients. Cancer thrives in a hypoxic environment, which means a lack of oxygen. Cancer develops when the immune system is compromised or distracted. Cancer develops when there's extreme stress. And there's cancer that develops when we're exposed to carcinogens over a long period of time. And cancer is a cellular disease. It develops when the mitochondria are disrupted or damaged and don't go through our normal cell death, which is apoptosis, and they divide and develop a tumor instead. They multiply. So when we're talking about the immune system, it's really important to connect the immune system and the gut together, because about 75% of our immune system lives right there in our gut. So let me explain the gut to you a little bit. There's a number of organs that are involved in our gut health. We have our stomach, we have our pancreas, we have our liver and gallbladder, we have our small intestines and our large intestines. And if any of those aren't functioning properly, then we risk the development of something called leaky gut, dysbiosis, leaky gut, which is an imbalance in our gut flora, and can to start to develop permeability in our gut lining. So it means that proteins can pass through our intestinal wall, and then we start to develop things like autoimmune disease, which can lead to more compromised immunity, right? Gut disease or gut permeability and dysbiosis are also linked to diabetes. Diabetes happens to be one of those diseases which can be a precursor to cancer. So diabetic patients are 3 times more likely to develop cancer. So nutritional therapy and repairing the gut lining is going to be key for you all when you come through your treatment to getting back on the right track. So nutritional deficiencies are also linked to cancer. And when we aren't digesting things properly, then we can't uptake and utilize the nutrition from our food in a proper way. So if you think about what you eat, like you could be eating the best diet in the world, but if you're not digesting it properly, you might as well cut out the middleman and throw the food in the toilet, right? So it's really important to think about your gut health as this sort of temple that you feed and nourish and make sure everything's working properly. And then you're putting in the right food to keep that system running the right way. A compromised liver and the ability to detoxify are also components of a cancer diagnosis. Pancreatic enzyme deficiency is also linked to cancer, which is probably why diabetics are 3 times more likely to develop cancer. And the other thing that I want to address here is that we store trauma in our bodies. And so I think that's something that's often overlooked when we're repairing our bodies and we're looking at becoming healthier. We also have to look at the spirit, right? We have to look at repairing our spirit and our soul, right? So a lot of times we hold trauma in our bodies and we often manifest it as disease. So when I'm working with a client, I look really holistically at what's going on. We look at mind, body, spirit, right? Our gut is linked to everything else. It's our second brain. And we make serotonin in our guts. We make all the nutrition that we take in is converted into usable forms in our gut. And so it's just like, I can't stress this enough, how important it is to keep our digestive system running properly. An impaired gut flora leads to, I think I said this before, leaky gut, which leads to compromised immune response. So we have to look at things like antibiotic use, right? So long-term antibiotic use can really impair our gut flora. Prescription meds or antacids can really impair our gut flora. Processed foods can really impair our gut flora, and stress and trauma can really impair our gut flora. So when we're looking at healing, we want to make sure that we're doing a lot of deep breathing, stress management, minimal processed foods, and keeping the prescription meds as little as possible. I know that's difficult in the time that you're in right now because there's a lot going on.
Nicole, I have a question.
Yeah.
So for many of the women in the group, they're on chemo forever, basically. So I think that's kind of a special situation where, I know when I was on chemo, I took like a ton of probiotics right in between, to try to. So I think that's kind of specialized because the chemo impacts gut health so much. So I wonder if you can address that a little bit.
Yeah, absolutely. I would say, one of the things that you can do really is start to incorporate things that are really healing to the gut. So bone broth is basically it's like soup stock. The idea is that you're pulling nutrients out of the bones of animals and you're utilizing the amino acids and the minerals in those bones to help repair your gut lining. There's a ton of research out there that shows that L-glutamine and L-arginine, which are major factors in bone broth, can help to heal that intestinal lining. So you want to start incorporating something like bone broth in your diet. And I often tell people to drink a cup of it in the morning, like as your first hot drink instead of coffee or tea, because it will set your gut up for success for the day. And you can make bone broth really easily on your own. I find that chicken is the easiest way to get into it because it is more palatable. If you haven't been using bone broth for a while, it's definitely more, I think the flavor is a little more palatable. So every time I roast a chicken, I save the carcass and I throw it in my stock pot right away, cover it with about a gallon of water, and then throw in about a teaspoon of apple cider vinegar and turn it on low for about 24 hours. And then strain it out and you've got your bone broth. It's done. I'll add some salt to it to make it taste better. But that bone broth is so healing for your gut. So if you can incorporate something like that into your diet every morning, it's going to improve your intestinal mucosa and improve your intestinal barrier. Probiotics are also really, really important. A high quality probiotic or eating foods that are probiotic rich are going to be really important. So including things like sauerkraut, kimchi, well, that's probably a little spicy for you guys, but kombucha, yogurt, non-sweetened yogurt, like plain Greek yogurt that has probiotics in it is going to be really helpful as well. There are a lot of supplements out there that can really help. I would recommend working with a nutritional therapist to help you figure out your supplements, because as you're going through chemotherapy, you're going to want to have some things in your back pocket that are going to help heal your intestinal barrier so that you're not continually compromising it, right? When you're taking in fiber, you have to make sure that you're taking in equal or more amount of water. Otherwise, it's not going to work for you, right? So it's going to clog things up if you're taking in too much fiber and then not taking in enough water. So I highly recommend making sure that you're hydrating, as you're going through your treatments. Hydration is going to be key. And that's the other thing that I really like about bone broth is that it provides a hydration and it also provides tons of amino acids and minerals at the same time. So you're getting this nourishing, hydrating drink. The other thing that I want to bring up is salt. I know that when you're going through chemotherapy, your palate it changes, right? So you definitely have different taste buds and things don't taste right and all that stuff. So you want to kind of play with your salt. I always recommend people use something like pink Himalayan salt or Celtic sea salt in place of your regular table salt, like your Morton's table salt. The reason why is because table salt is stripped of all of its nutrients except for sodium, whereas Himalayan pink salt or Celtic sea salt contains probably about 95 trace minerals in it, and it doesn't just raise your sodium. So you're going to want to play around with your salt a little bit, but using a high quality salt is extremely important as well. It's going to help balance your electrolytes. People often tell me they don't feel hydrated even though they're drinking a ton of water. If you add a little tiny pinch of your pink Himalayan salt into your water, it will help your cells absorb the water. It will help you feel more hydrated and help the uptake of the water, okay? So it's electrolyte balancing. So the other thing that you want to really pay attention to, like on the track of maintaining an alkaline environment in your body, is your breathing. Oftentimes when we're stressed and we're feeling like fear and we're holding in the childhood trauma and all of that stuff, our breathing gets really shallow. So one of the things that I like to do is make a small promise to myself every morning before I even get out of bed, is I'm going to take 5 diaphragmatic breaths. So I'll hold my stomach and put my hands on my belly, and I'll just breathe deeply into my belly for a count of 5, and then breathe out for a count of 5. And that's going to help calm your nervous system and help your cells uptake oxygen. Okay. So when we're talking about cells, this is the other thing about cancer, is it's very much a cellular disease, right? So we're talking about mitochondria, ATP, all of the things that affect cells. And our cells are covered in a layer on the outside of fat, a layer of fat. And we want high quality fat in our diet in order for oxygen to be able to come in and out of those cells easily. And when we take in highly processed fats like canola, soy, corn, oil, things like that are super highly processed, well, that layer around our cells gets compromised and it becomes brittle, and it doesn't allow oxygen to pass in and out. So what we want to do is start using high quality fats in order to repair that layer around the cells. So things like olive oil, flaxseed oil, and avocado oil are really beneficial in repairing that cellular layer around the epithelial layer. Okay, you don't want to overdo it with coconut oil. The cool thing about coconut oil is it doesn't require bile to break it down. So if you're having trouble with your liver or gallbladder, it's a really nice way to get some high quality fat in your diet without having to sacrifice, without having to use bile to break it down. And then as much breathing, body awareness, mindfulness, and I know it's hard to get exercise right now, but as much movement as you can incorporate is really, really important. So prebiotics are basically the food for your probiotics. So you want to get a combination of both. So probiotics, get a high quality probiotic and then feed it with a prebiotic. So you can do that supplementally, no problem. You can also do it with food, depending on where your appetite is at. Things like artichokes, Jerusalem artichokes, garlic and onions, all of those things are prebiotic foods. But I know that getting those things into your system sometimes can be hard. Constance, you should be drinking bone broth every day. Yeah.
Like a cup a day or something?
Yeah.
Okay.
Like get your mug, fill it up with broth.
Okay.
Sip it every morning.
So maybe more like a pint every day.
Yeah, I suppose so. It's probably like 10 to 12. Yeah, I'd say 10 to 12 ounces would be good every day. Yeah.
Okay.
Yeah. But I do know that a functional doctor is able to take insurance and NTPs are not. But both of them will be able to give you the supplementation and the help you need as far as digestive repair. The other difference is an NTP can also help you a little bit more with food versus functional doctor specializes more in just getting the supplementation right. So when I work with people, we work on repair of the digestion, getting that all set, and then we set the foundation for keeping our work, like not undoing all the good work we've just done, right? So we want to get the digestion working properly, and then we want to make sure that the food we're putting in there is right. And for you guys, the things that you really want to focus on are highly nutritious foods, like things that will, like every time you take a bite of something, try to get the most bang for your buck out of it. right? So the things that I find the most helpful for cancer patients are soups. And the reason for that is that you can throw in a whole bunch of a rainbow of vegetables. So you can throw them all into a soup pot with your bone broth, right, which is healing, and some nice herbs and things like that. And then you have the option of blending it up, because oftentimes I know with you guys, it's hard to, like, the mouthfeel doesn't always work right. Like, things don't taste the same, or you don't want to the option of blending things up a little bit. And that's a good way to get nutrition into your body.
If one was shying away from bone broth, what would be the next thing?
So I would make your own vegetable broth. So get a big pot or in your crock pot, put in all your scraps, like your onions, your carrot tops, your celery root scraps, whatever, into your crock pot with water, and then get yourself some kombu. It's a seaweed, and it's going to provide you with the minerals that you need.
Where would I get that?
You can. I find the best place is to order it online. Go to Amazon and just look up kombu, and you can get like a big package of it, and just put a half a piece or a piece in whenever you're making your vegetable broth. If you can afford organic food, buy organic food, right? Especially your meat and dairy. Okay, so that's
okay. I do have a question. A lot of times for me, I always have this, because I get chemo once a week, usually on Wednesdays. I always end up with this crazy metal taste. Like everything just tastes like metal, soup, everything. So what's your suggestion, or do you have a recommendation that can help tone that all the way down for me?
Oh, that's a tough one. Everybody's different. And so what I would suggest is playing around with adding a little bit of acid to whatever you're eating, maybe like a little squeeze of lemon or a little bit of vinegar or something like that, to see if that helps. You can try playing around with your salt ratio, but try experimenting with a little bit of seaweed too. See if try to help to, like, put in a little bit of arame or kombu into some broth and see if that helps the minerality. That might help a little bit. So sea vegetables are another thing that's really a great resource for you guys, is including sea vegetables. Mushrooms are a big one that you want to get into your diet. Okay. And a rainbow of fruits and vegetables, healing bone broth, and high quality fats. And egg yolks are great for you guys. You want to get that choline in your diet. It's really healing. Yeah.
Last week, they said I was on the low level of my blood work was low for, being compromised for being able to take the chemo. Nutritionally, might there be some suggestions to bring my blood levels back up?
If you can, try to eat as many mushrooms as you can.
Okay.
So I would recommend taking a mushroom supplement, like maitake mushroom supplement or lion's mane mushroom supplements are really going to help your immune system.
Okay.
Yeah. So, I mean, and there's some, like, honestly, if I was your nutritional therapy practitioner, I would be putting you on an immune supplement that contains things like maitake mushrooms and things like that.
Okay.
So, yeah. There's a company called Pure, Pure.
Oh, okay. I've heard of them.
And they have a supplement called Pure Response, which is a multivitamin that has specific immune boosters in it.
You have been a ton of information. Thank you so much.
So great. Yes, so great. Yeah.
Oh, you're so welcome. I was so honored to come and speak to your group. And if there's any time that you want me to come back or have questions, please let me know. I want to be of support to all of you as much as I can. I just want to reiterate to you guys that You know, I truly wholeheartedly believe that everything stems from your gut. Like all the stuff that we deal with in our bodies starts in the gut. And so we have to nourish that piece before we do anything else, right? And gut health and mental health are all tied together too. So make sure that you're taking care of you. I mean, how many of you have been taking care of everybody else besides yourself? Oftentimes we as women take on so much, right? We just want to be everything to everybody, and we end up putting ourselves in last place. And it's time now for you all to put yourselves first, because oxygen mask theory, right? If you can't get the breath for yourself, if you can't take care of yourself, you're not going to have anything to give to anyone else. So remember that it's time to take care of you, and self-care is absolutely the most important thing you can do right now. And if you look at nutrition and repairing your own inner workings as self-care, it can be life-changing.